Hello, my name is Dr. Jay Gottlieb. I'm a board-certified dermatologist as well as a board-certified facial plastic surgeon here at Miramar Dermatology Skin and Cancer Associates, a center for cosmetic enhancement. Let's talk a little bit about photodynamic therapy, also known as PDT, or blue light treatment. This procedure is used to treat precancers on the face and scalp. Precancers are also known as actinic keratoses. A keratoses is a scale on the skin. Actinic is the sun. Therefore, these are scales caused by the sun, and they are considered precancerous. A relatively small percentage of these will turn into a squamous cell carcinoma over the course of time. Therefore, treatment is indicated. When a patient only has one or two of these actinic keratoses, we can use just some topical liquid nitrogen and apply it in the office. This causes a blister and the actinic keratosis will then disappear. There's also an alternative utilizing 5-fluorouracil cream that we apply to the face twice a day for 2 weeks, to the scalp for 3 weeks. This also seeks out and destroys a lot of the precancers. The latest treatment, and in my opinion probably the best treatment for actinic keratoses and severely damaged skin from the sun, is photodynamic therapy. What is done is the patient comes to our office and the skin is then cleansed, oil removed, and a microdermabrasion is then performed. A chemical is then applied to the treatment area. The chemical is called aminolevulinic acid, or the brand name of one is Levulin. This is applied to the scalp or to the face and allowed to sit for a period of time, usually less than an hour for the first treatment. The patient then sits under a blue light, a type of ultraviolet light, for 16 minutes and 40 seconds. There can be a little bit of stinging, and over the next several days, depending on the patient and the amount of actinic damage, there can be swelling, redness, discomfort, and stinging. A second treatment is usually performed 6 weeks later. Depending on how the patient did with his first treatment or her first treatment, the Levulin is allowed to sit on the skin for less or more time. Typically, the second treatment does not carry as severe symptoms since most of the damage has already been taken care of by the first treatment. By undergoing this treatment, the actinic keratoses are destroyed and we are able to see the patient's skin look much more youthful. Whether this procedure is appropriate for you or not would be determined at the time of consultation. Not all board-certified dermatologists have the blue light treatment in their office. If you would like to come in for a consultation, you may call our office and set up a time for an appointment. Many times the insurance will cover this. Sometimes the insurance policies do not. It depends on the type of healthcare coverage that you have. When you come into the office, if we think this is a necessary procedure, we will ask for authorization from your healthcare provider, third-party healthcare provider insurance. You can also make an appointment by calling our office or clicking on the Contact Us button up at the top, and one of our members of our staff will call you and set up a time for an appointment. Prior to coming into the office, it would be good if you clicked on the Register tab and fill out your paperwork. Then you would spend less time in the reception area and more time in the exam room with me and the consultation office. I look forward to seeing you in our office. Thank you very much for visiting our Miramar Dermatology website. I hope that I answered some of your questions. There's other areas here on our website where you can find out more about photodynamic therapy, or PDT.